remember, Project Aware is the name of a grant awarded to the Colorado Department of Education from SAMHSA, the Substance Abuse Mental Health Services Administration. This 5-year grant is focused on building infrastructure and expanding the capacity of state and district partners to provide school-based mental health supports. Colorado's Project Aware is working to build a comprehensive, coordinated, and integrated school-based mental health service system that supports every student in Colorado. You might also remember that we connected with your organization sometime over the past year to discuss a youth-led state-level effort promoting youth leadership in school-based mental health and related work. So we're reaching out to you today to provide a quick overview of the project and a reorientation to what we would be looking for in a partnership with you, your organization, and the amazing youth you work with. Should you have any questions after viewing this video and/or reading through our overview document, we encourage you to reach out to us. Now, Kyle is going to share a little bit about what we've been doing and what we've learned.
Thanks, Morgan. So before we jump into specifics about this project, we do want to share a little bit about where we've been and what we've learned from you all. And so over approximately this past year, we've met with about 20 youth leadership organizations from across the state. Those organizations we met with were particularly either focused on a youth-led model or approach to their work, but also what was really important to us was to meet with folks who work in the most under-resourced communities in Colorado and also work alongside youth with currently and historically marginalized identities. And so from those conversations, we really heard what you all believe is needed as far as what the Department of Education and the Department of Public Health could do to meet those needs of youth across the state. And also, what are your aspirations for youth when it comes to mental health promotion? And so what we've learned is for those youth participants in this project, if we were to move forward, really for them to be successfully able to plan and execute their own projects, we definitely need to implement a model that offers the proper support, structure, and resources to them. And in addition to that, we need to offer them leadership development opportunities or trainings as part of this experience. Additionally, we heard that we need to focus on partnership development and relationship development rather than what is traditionally a transactional process or transactional relationships. And we really hope that what you'll see, what we've developed is a framework of sorts that will allow us to have a continually evolving effort or project over time. And the last couple of things that, that we learned that was made very clear to us is the adult participants that are part of this project will actually also have to go potentially their own learning or unlearning in order to be great adult allies, and also the importance of centering the under-resourced and currently and historically marginalized. So, in addition to sharing what we've learned, Morgan now is going to share a little bit of information related to the current climate and needs for this project.
Generally speaking, the need for this effort falls into 3 buckets. First, let's start with why we're all here, our youth. There's a huge need to continually push for research-informed youth-led prevention and mental health promotion efforts, because youth are still in crisis, especially those who have been historically and are currently marginalized. For example, the 2021 administration of the Healthy Kids Colorado survey shows 26% of transgender youth attempted suicide in the past 12 months. That's compared to 6.6% of their cisgender peers. 10% of multiracial youth attempted suicide in the past 12 months, compared to 6.7% of their white peers. A high school student in Colorado is 3.1 times more likely to report attempting suicide 1 or more times during the past 12 months if they also report sleeping somewhere other than their home during the past 30 days, as compared to those who do not. Next, our schools have a lack of research, culturally grounded approaches to youth-led prevention and mental health in school settings. Also, school buildings are struggling with intervention capacity, since adults are seen as the primary implementers and interventionists while they work through staff retention and recruitment challenges of their own. At the state level, we have a lack of youth engagement input and decision-making. And find that we at the state are uniquely positioned to be a broker and bridge maker between youth leadership organizations and can leverage our sphere of influence to support youth-led projects. Now, Kyle is going to walk us through an overview of the entire project.
Thanks, Morgan. And what I'll cover quickly is just a very broad overview of the project, but in this video, we'll go into more details about the specifics. But what I'll be sharing is really that vision for year one of this effort. And as part of it, we really do see there's three types of key stakeholders. There's our adult partners and their adult track. There are the youth partners and the youth track. And then we at Project Aware, we work within the Department of Ed, Department of Public Health, and the Behavioral Health Administration. So the first track I'll cover, the primary track, is that adult track. And so as part of that experience and part of your involvement, one of the key components and outcomes of this work is these adult ally toolkits that'll focus on, how do educators, how do school staff, how do community partners really do youth-led mental health promotion in line with the best practices and the innovations that we know from talking with you all that you all are experts in. Additionally, once those toolkits are produced, we're hopefully going to be able to partner with you all to disseminate that information out to schools, to school districts. And then the last part of that track, which we've spoken to a little bit already, is that unlearning and learning, and really the emphasis on that training is to ensure that we as partners with you all we have shared language of the work that we're doing, but also to ensure that we at CDE and at the state government are doing our due diligence to make sure that the language and lingo and the frameworks that the folks in education use, we are all on the same page as well. For the youth track, we'll also obviously be evaluating learning outcomes from the adult track, but for our youth efforts, obviously we want to provide the structure and support for youth to really implement their own mental health promotion efforts. And to do so, we will be providing them with professional development training, which will be delivered by adult partners, you all. But also there'll be a facilitator of that youth track and that youth experience. And as always, we will be not only evaluating the youth outcomes from those trainings, but also trying to evaluate the youth to adult and the peer-to-peer processes or outcomes. And with that being said, Morgan will provide a little bit more details about the youth partners track.
So let's go over some of the specifics for the youth-led track. Each of these components, training, meeting facilitation, and evaluation tools, involves opportunities for compensation and partnership with us depending on your organization's capacity and interest. On page 4 of the overview document, you'll find the training opportunities outlined in greater detail. There are two main themes, including knowledge development and skill development. For each training, should you decide your organization would be a good fit for these sessions, would be $500 per session. With these knowledge and skill development trainings, it is our hope that young people involved in this project will be better equipped to plan and execute their youth leadership aspirations. But we know that it is best practice to have an adult ally facilitation, which brings us to our next opportunity for partnership. We've learned a good adult ally or facilitator has these characteristics, and if you'd like to read more about how we've defined these, see page 5 of our overview document. If you think you'd be a good fit for meeting facilitation, you'd be compensated $5,000 to $8,000 this year, with the opportunity for additional funding in future years of implementing this project. This facilitation is a bit of a larger time commitment and would not only involve planning and facilitating the youth leadership meetings, but convening with us, Project Aware staff, and leadership to provide updates and recommendations based on youth input. Important note here, you're not limited to only partnering with us in one of these areas, but instead, please consider all the ways in which your organization might be a great fit. And finally, in order to measure impact and to continually learn, it will come as no surprise we will be evaluating this important work. We've put forth 3 things we would like to measure and are certainly open to the idea that there are additional ways we could evaluate this youth-led track. Should you decide you'd like to be a part of developing and implementing the evaluation, we are offering $2,000 to $5,000 per tool. For more information about each of these components, see page 9 of the overview. And now I'll send it back to Kyle to provide more details about the Adult Ally track.
Thanks, Morgan. And so now I'll go over just a quick overview of that Adult Allies track, which includes training for our Adult Allies, the toolkits as outputs for our work together, and our vision for disseminating the knowledge you all have to schools and districts across the state. So the first component of the adult track, and really our aspiration, as I said earlier, is to ensure that we're speaking the same language. And so there are 3 different trainings that we're going to be asking our adult allies to complete as part of this experience. The first one being training on Colorado Multi-Tiered Systems of Support, or COMTSS, and Mental Health in Schools 101. The second component of adult track training is ClassroomWise. And so ClassroomWise is an online self-paced training where you all will learn what is being taught to educators and school staff related to social emotional learning, culturally responsive and trauma-informed approaches for school-based mental health and support. And the last component of training, which we know based on y'all's input, we may or may not keep as a required component, is just social development strategy and positive development 101. And if we recognize that we're all kind of already on the same page, we'll just eliminate that as part of this component. But more details about these trainings can be read in our overview on page 6. The next component about that Adult Allies track is these Adult Ally toolkits. And so really what our vision and the recognized need is, schools need to know how to do youth-led 3.0, the most modern version with the best practices. And you can find more details about these toolkits on page 7 of the overview. But very broadly speaking, we want to have 3 different toolkits developed as part of this experience. One that targets school-based mental health professionals, one that targets educators, and another one that'll help us move our community partners or other community partners across the state that are working with schools on how to do youth-led school-based mental health in their local communities. So we're really hoping you all can help provide that expertise that we can provide to folks across the state. And so what I can share is for each individual toolkit, compensation will be between $5,000 and $8,000. And lastly, as part of the adult track, is that adult training or the adult just the dissemination of the great toolkit that we're looking to you all to help us build. And, those trainings will be ideally made available online through online trainings, or potentially, you all would be interested in attending conferences and speaking in front of school-based mental health professionals like counselors or social workers or therapists. And so we're not exactly sure. We can't put a compensation amount yet on that training and dissemination, because we really don't know what those toolkits will entail. We don't know if it's a half-day training, full-day training. So when the time comes to determine compensation for those trainings, we'll be looking to you all for how to properly compensate you for your time and your expertise. So once those are delivered, part of that process, as always, is we will be measuring the learning outcomes of the participants of those trainings, just to see the effectiveness and how we can continually to improve those resources for the general public.
Thank you for your time tuning into this video. We are so excited to potentially partner with you. We kindly request you send your draft of your scope of work by Friday, March 3rd. And should you need more time, please just let us know. Remember, this is only year 1, and we are looking forward to growing something that changes the trajectory of youth mental health in Colorado with all of you. Hope you have the best week available to you. Thank you.